Hey folks, Doug Blake with Body Design University. Welcome to another weekly study. And today I got a really good study for you because it's based specifically on a question that we got from a student. I believe her name is Amy. Just recently, just either today or the day before. And it actually refers to the assessments issues in the sixth edition. And don't want to I can spend a lot of time going through it. If you haven't gone through the chapter 10 study that we have them on YouTube. We have all the chapter studies as well. Remember, there's a general study guide, helps you focus on those particular chapters that you need to focus on for passing the ACE exam. And then we also provide more in-depth for every chapter. And that's about as deep as we go when it comes to studying this material, which is why we do the weekly studies, because it allows us to go even more in depth into very specific areas, which is what we're going to do today. Now, the way I want to do this, and I'm going to pull up a PowerPoint real quick here for you. The way I want to do this is kind of go through, and I'm calling this assessments clarification, chapters 10 and 11. But one of the things to keep in mind with the sixth edition, I've said this before, when ACE moved from their fifth to their sixth edition, I think they did a great job because there's more of a real world feel to the information. Now, that does not mean that it makes it any easier to answer some of the questions. And that's why this is a great area to go over today. It's based on a question about assessments and which particular area a person should be put into, or what the trainer is going to decide to put them into when it comes to which phase of training and then which assessments to use. So I want to hit it from the context of the question itself, because that's of course what most folks, and I know Amy, who was actually asking this question, is really trying to figure out. For the most part, what ACE did is they kind of stepped back and said, in the real world, how do we know what assessments to do with people? How do we know where to put them in their IFT model? And the answer is we don't, because ACE will tell you this in the first couple of chapters. And I think that, again, I think they did a great job by sort of attacking the elephant in the room, which is that not everybody likes to do assessments. Not every client will do assessments. Okay, that's not a problem for me. I'm going to do what I need to do as long as it's within the purview of the client's goals. And so that's what ACE talks to. Just keep in mind, there has to be an academic component to this. There has to be some very clear guidelines on given information about your client. You do your pre-participation screening. Remember, they talk about this in the early chapters. So that's why, for those of you that are having issues with assessments and which area to start a client in, should go back and look over some of that information. Is it confusing? I would agree with you. Absolutely it is. But that's only because ACE is trying to navigate a lot of information, and they want you, the trainer. This is why I actually like it, is because you, the trainer, then get to decide, because there's a sort of an art, a technique to determining whether or not certain assessments should be done. So that's kind of my intro, and I'm hoping I can clarify this for you. Just keep in mind, ACE is not trying to confuse you with their questions. They're trying to see whether or not you can navigate through the information and put it all together. And that's why what I've done is I actually put the question here off of our Facebook group. And that's, by the way, that's one of the reasons why we tell you, if you have questions, do exactly what Amy did and go ahead and just post it, get it out there, because that's what we look at for these weekly studies for the most part. And we can respond directly, or in a case like this, it just makes a lot more sense to provide the information to everybody. So here's a classic example of one of the, and this is on obviously the ACE website, one of their quizzes, the ACE Mover method and assessments. Also, just so you know, I've pulled some of these pages that I want to reference you to, that is going to help, I think, pretty significantly. And I've done a study on this before where I talked about phase assessment. but it's the or the phase determination, but not the assessments. And this is where I absolutely agree with those of you that have said ACE doesn't say anything about the assessments and which ones to do based on the phase that they're in. And I'm going to agree with you that they can actually do better with that in their case studies. And that's what I'm going to lead you to, which is in chapter 11. However, I will say this is that if you scratch below the surface and start looking through these particular areas in chapter 10 on assessments, ACE actually does tell you which assessments you could potentially use. And that's why I want to look at the question first. And I want to analyze the question because, again, this is where most of the confusion is going to occur. So before I even get into that, I'm going to just help you with one thing when it comes to questions like this, these questions that are what we call situational questions. A client is this, and they give you this, and they pose this, and they've got this issue, blah, blah, blah. What would be the best, or what would be the blah, blah? Those are situational questions, and ACE likes to ask a lot of them, so just be prepared for it. There is one thing you have to remember when it comes to these situational questions is that there are assumptions that ACE wants you to make. That's what this is all about. They want you to assume certain things because they simply don't have the space to provide all of the information that you would want to have when it comes to answering this particular question. So here's a classic question. You have an avid golfer who wants to improve his game. Okay, stop. Right off the bat, what's the piece of information that you received? Okay, this is where you have to be fairly quick and don't overthink, because you're not going to get a whole lot more information on this question. Believe it or not, you already have enough information to tell you quite a bit of what you need and what you don't need to do. Okay. Your client is not a golfer or a weekend golfer. He is a avid golfer, which means he is sports specific. He has actual sports related outcome goals. Right off the bat, you know that individual, for the most part, is going to be fairly athletic, whatever the case is. And that's why we're going to go through the case studies to kind of show you this. So your client is an avid golfer who wants to improve his game. You already know what the outcome goals are. You already know what this client wants to do. And all you have to do is go through your textbook, okay, when it comes to the assessments. And when you read through the assessments, they'll tell you who is best designed to use, or who would you use this assessment for? And they will specifically tell you. And I've got it pulled out here, but I don't need to go over with you, but you can go through it in chapter 10 itself. So the static postural assessment, for instance, who should be doing static postural assessments? Who should be doing movement assessments? That's why you read through that chapter. That's why it's an important chapter, but it actually starts to make sense because they have given you in chapter 11 3 case studies that are going to clarify to a certain extent what you should be determining after you've determined the actual phase. So remember, let me go over here with you. They already tell you he has a history of low back pain. So what does that tell you now? Well, it's a limitation, right? However, just because there's a limitation doesn't mean you automatically start them in the functional muscular training phase. No. Why? Because he's been cleared to train with you. Heck, I got low back pain. Please don't put me in the functional training phase if I've come to you for training. You're going to put me in the load speed training phase for sure, without even a question. But your question is, well, why? So this is the first one we determined, and it's because of this, okay, and this, right, that the question might be confusing to you. So he's cleared to train. So there's your 2 pieces of information. He's an athlete. He's trying to increase performance, right? And he's fine. He doesn't have any issues. It doesn't matter that he has a history of low back pain. Okay, he has been cleared by a physician. Now, if you look at any of the assessments, for instance, the Thomas test assessment will tell you, don't perform this on somebody with low back pain. with low back pain. So if they have low back pain, don't do the test unless they've been cleared by a physician. So look, I technically could do a Thomas test on this guy, right, to check flexibility and hamstring and lower back or hip flexor, hip flexor, flexibility and rectus femoris flexibility, which is what the Thomas test is designed for. Right? Do I need to do that for this individual? The answer is going to be no. So there's two pieces of information. Avid golfer, he's athletic. It doesn't matter that it's golf. It's still an athletic endeavor. He's trying to improve his game. He's trying to improve performance. He's in the base training phase of the cardio. Okay, that's easy. Why? Because he doesn't do any cardio. That's how you know somebody is in the base trainings, because they don't perform on a regular basis, 30 minutes, blah, blah, blah. That's like clear as day when you read through the cardiovascular assessments. He's already told you he doesn't do anything, whatever the case is. ACE has already told you he's in the base training. Don't ask any other questions. Okay, that's not a big deal. So he's not doing a whole lot of cardio respiratory type of activity, no problem. Based on this information, whoa, wait a minute. I don't get anything more than that. And the answer is actually, no, you don't really need anything more than that. Okay. So your question, your determination then is going to be, he's not in functional. Why? Because he's already an avid golfer. Your question that you need to answer is, does he go into the movement phase or the load phase? Now, here's what you're thinking. Load speed, golfing? Golfing doesn't no. You got to remember that it's based on what the client's goals are. What we know is that the movement phase is designed to help the 5 movement patterns, right? So a person, that's why we're going to look at it here in these samples that they have for you. And that's why these are important. There's 3 of them, just so you know, started on page 521. So you have to determine whether it's movement or load speed. I'm not going to answer that question yet, but that's what you're now thinking, right? You just read the question. You're like, well, movement, load, speed. Then the question is, well, what assessments, right, should I do? And it's saying select 2. Okay, saying select 2. You've got 4. And now you have to ask yourself a question based on one of these guys. What type of assessments would I do? Okay, so I'm going to come back to this, but that's how I want you to think through the question. I wanted to hit it from this vantage point so that you can see the question first, and let's answer, or at least think through the question. And so that becomes really important from the test taking perspective. Once you're done with the test and you've passed your ACE exam, you do whatever you think is most important for your client. You might not use any of this at all. Right? That just may be the case that you look at the IFT model and you go, okay, I can use a little bit of this, a little bit of that. That's not the most relevant part of it. The most relevant part is that you answer the question and understand why. So let me just show you what I did a couple of weeks back, is the phase determination, muscular training phases, right? You would start somebody, and let me just run through this quick. You would start in the functional training phase if the client shows clear signs of postural or balance issues. They walk in, they're elderly, just as a for instance. Not every elderly person has these issues, but that might be a concern. And they show some basic balance issues. I mean, just fundamental stuff, right? That would be a sign that they're not ready for resistance training. They're not ready for movement pattern training. You would start them in the functional training if they show clear signs of postural or balance issues. Okay. And again, that's your determination. You have to decide that. You may look and go, oh yeah, that person posturally, man, look at them. They're a mess. Now, my wife's an occupational therapist, so she may see, and she does see a lot more physical dysfunctions because she works in the field and she works with people with those issues, versus me. I look and I go, yeah, they're fine. They're walking. They walked in, not a problem. That's for you to determine. And ACE has basically said correctly, I believe, that this is basically up to you, the trainer, to make that determination. So nevertheless, or their health history determines those limitations. See, here's where the pre-participation screening comes in. And this is one of the reasons why you read through that particular chapter. I think it's chapter 7 in the 6th edition. Okay, nevertheless, what functional assessments would you use? Well, as needed, if any. Remember, the goal is not to do more assessments. The goal is, ironically enough, to do less assessments. You only want to do as many assessments as is needed to help determine either the phase they need to be in or to assist with maybe some information gathering. Look, if you've got somebody that never works out, doesn't do any type of training, is showing clear signs of postural issues or balance issues, and they do their health history form, and it's like they had a stroke 2 years ago, yada, yada. Why do you need to do any functional assessments? You already know what you're going to do with them. Can you do postural? Yeah, but why would you do it? You already see, this is the point, is that these questions are designed to get you to assume certain things. The goal is not to do things because they're a golfer. Just because they're swinging doesn't mean you need to test or do the Mcgill torso test. That's not what the Mcgill torso test is designed for. When you go back into chapter 10, read through what the Mcgill is. Go and Google it. I mean, there's a ton of information on all of these tests outside of the ACE textbook itself. Remember, these are for the most part therapeutic. This is done by therapists. That's what these tests were actually designed for. We've watered them down back into personal training just to kind of assist and help. So what functional assessments would you need to do? Do you need to do a static? I guess you could, but the point is that it's not necessary. It's not the best practice. If a person is a hot mess, posturally, balance-wise, it is what it is. What are you going to do with them? You're already starting at the base level. So you don't need to do a whole lot of assessments. Don't do assessments just because they're available to do. And ACE actually tells you that. And some folks, by the way, they don't want to be doing a whole lot of functional assessments. Well, I used to do them all the time, and then I stopped because the people that I trained, for the most part, all had bad posture. So it's kind of like, I already knew what I was going to do with them. I don't need to spend the 5-10 minutes, whatever, doing assessments. I want to get them working out, whatever the case is. So there's your functional training, right? People are in muscular functional training when they're at sort of the lowest level. They can't even do the 5 movement patterns effectively if you even were to try to do it with them. Why would you do that? You wouldn't need to do movement assessments because you already know they're at even a lower level or lower phase. So that's important. So why would you start somebody in the movement training? Well, functional assessments conducted show. Now, here it is. When you have somebody that walks in and they're ready to train and they're just trying to get better at maybe a running sport, they want to do 5K at that end, or they just want to lose weight and they're fine and they show no overt or they show no clear signs of postural or balance issues, then you can go, okay, well, they don't have athletic or more extensive outcome goals. Okay, I have to make a choice, movement or load speed. Well, how do I determine that? You have to do some functional assessment. And the functional assessments conducted show proper balance and stabilization, right? So the functional assessments could be the static balance. Sure. Now, at this point, when somebody comes in, now I want to be a little bit more cautious and say, let's do a static postural assessment. Then we can do a dynamic assessment as needed, right? And there's a couple of them in there. However, you'll notice that on the test question, that quiz, what didn't you see? Muscular movement assessments. So that's not going to be one of them for that particular question. So just keep that in mind. So movement assessments as needed, right? As needed, the 5 movements, bend, lift, single leg, etc. Now, let me stay here for 1 second. Why would I need to do a movement assessment for somebody that has no major outcome goals, right, to increase performance or whatever the case is, right? I would start them in the movement training phase and I would work on the 5 movements. Now, it doesn't mean that they don't show proper balance and stability. They very well could. In fact, that's one of the main assessments I would do with the average client that walks in. I would do a basic movement assessment. I don't have to do a whole lot of other preliminary assessments. because I can already kind of gauge or guess, yeah, the person's walking in fine, whatever that case is. I want to do a more appropriate assessment to see whether or not they've got the bend and lift part, whether they can squat properly. That's when I would then do those particular assessments. Would I do a static postural assessment? Perhaps. See, if you want a clear, defined answer, that's what ACE is not going to give you. I wouldn't give you an answer either, because I don't know. If I see a person walk in and they're standing upright and they're walking, I'm not sure I'm going to do a static postural assessment, but I could. And so this is why in the MOVA method components here in the chapters, it's helpful to kind of read through and understand what ACE is looking for. Just remember, this is their IFT model. I'm not saying I use any of this stuff training people, because for the most part, I don't need to. But for you, you may want to do it and feel more comfortable. And as you get more experience, then you may or may not use any of these assessments. Now, third part here, when do you start somebody in load speed training? Well, if they're able to perform exercises through the 5 movement patterns with no loss of joint stability or postural control. You'll notice on the question that was asked, you saw nothing about this, okay? Why? Because he's an avid golfer. What does that mean? I know a lot of folks who are avid golfers, but they're not really in good shape and they have balance issues and their technique is terrible. Now you're overthinking it. The fact that an individual is an avid golfer and they're trying to improve their game, okay, that's a good indicator that you might be seeing somebody that, as long as they, have the 5 movement patterns, no loss of joint stability or postural control, you can possibly start them in the load speed phase. And again, that's why I keep referring back to chapter 11, these case studies. Okay. The other thing is that muscle endurance strength assessments as needed. Okay. Again, here are some of the questions you're kind of juggling. Well, which assessment should I use? Hang on for a second. Hang on, because remember, in the question, you had 4 options. You had 4 options. And that's why when we go back to it, we're going to look at that. And it's going to be, I think it's going to make a little bit more sense as to which ones you would pick. So muscle endurance strength assessments as needed based on collaboration with clients' needs and goals, right? So if a client is trying to increase power output, their their athletes, track and field, whatever the case is, well, then you may need to do a power or speed assessment. You might want to do the jump test or one of the other power speed assessments that they're using. That's when it might make sense. You don't see that though. So let me go back up to the question. So again, your client is an avid golfer, wants to improve his game, has a history of low back pain, has been cleared to train with you by his doctor. That's it. That's all you got. Now, what do we do? Not too difficult in one sense. You could say movement, but more than likely it would probably be load speed. I do not know the answer to this particular question. I'm talking through it with you. Now it's either this or this. And when I go through the case study, it's still going to be a toss up, but I think it's going to make more sense to go with load and speed. Well, what assessment? Select 2, static postural assessment. I don't think so, but what do you see here? What is the Y balance test? If you go into chapter 10, the Y balance test is actually designed for athletes. I don't do the Y balance test. I don't need to, but I'm saying ACE does, and ACE thinks that's an important test. So I hope that makes sense. You're dealing with an athlete trying to improve performance. More than likely, the Y balance test would be one of those that you would choose. I'm still not sure whether I need to do static postural assessment, but probably not. Okay. The Mcgill's torso muscular endurance test battery. Again, if you read through it, this is designed perhaps for those individuals that may show signs of unilateral discrepancies in muscular strength. I don't know. What about flexibility assessments? Well, flexibility assessments are designed to show discrepancies or inconsistencies in obviously flexibility at joints. Do I need that with an avid golfer? See, there's the question. If you read through on what flexibility assessments there are involved with this particular chapter, it could be that, yeah, perhaps there's one or two, because remember, it's saying flexibility assessments. It's not saying all of the flexibility assessments, but it's saying, would you use flexibility assessments? And that's really going to come down to whether you decided whether it was movement or speed. And that's all I'm going to give you on this is, again, I'm trying to get you to think through the pattern. Now, because of that, here's what I want to do. So let me just make sure we understand. You have this piece of information and you have this piece of information, and he's cleared by his doctor. It's not an issue, which means that his lower back pain was probably nothing more than doing a whole lot of golfing, right? Because the twisting can cause low back pain. And again, remember, avid golfer, not a weekend golfer, not a just something that he does for fun once a month. He is an avid golfer, so he probably does it quite often. So he's fairly athletic. And what does he want to do? Improve his game. How do you improve the game of a golfer? He's got to swing harder, right? He's got to have postural control, stability. He's got to be strong, so he needs to be training. That's why you would probably look at the load speed. History of low back pain, but has been cleared by his doctor, means that he's fine. He's fine. He's good to go. I don't know what causes his low back pain, but if he's an avid golfer, like I just said, could be that he's just putting a lot of stress on his low back. Okay, given that. So let me go ahead and do this then. Now what I want to do is, with that information, now that you've got that, you kind of pick apart that question. I hope that helps itself. Now what I want to do is kind of look at these three. And if you have your textbook, go ahead to page 521, because now they give you, this is chapter 11. And I've pulled the pages out, by the way, just so you know, and I've kind of made some highlights on it. And let me walk through this with you, just so you understand. I'm not saying this is going to clarify everything for you, but it should help. The first one is an individual. She's already competing or completing 30-minute runs. So this is already, she's athletic in that sense. So she's starting in the fitness training. We're not worried about the cardiorespiratory part of this. But when you read through on page 521, 533 is the next one, and then 543 is the third sample individual. You're going to look basically at the muscular training phase. Now, yes, my question to ACE, which I'm sure you're asking also, is, well, when they did these, why didn't they put the assessments on it as well? Which they don't. I can't find them. So I'm looking at these samples, and I'm saying, okay, well, I've got Valerie, right? If you're read along with me. I'm Valerie, blah, blah, blah. She's performing this. It gives me a very clear definition as to why she'll be in the movement training phase, right? It's because during the first assessment, she was assessed as she performed body weight exercises in the 5 part. Well, what assessment did she do? She did movement assessment, right? Because we already know she's an athlete, she's exercising. I don't need to do static postural assessments, just as a for instance. I don't know if they did or not. ACE probably needs to clarify this a little bit more and make it a little bit more specific as to the actual assessments. All they're saying is that she was assessed. Well, which assessments? Be that as it may, let's continue on. She performed during the movement assessment. She displayed adequate postural stability. Boom, right off the bat, she's not in functional. She's either in movement or load speed training, okay? Because of how she performed during these assessments, right? Postural stability, she'll begin a program in the movement training phase. You understand why? She's not functional. Her goal is not to become a more powerful, stronger. What was her goal? She's currently performing, right? And her frequency of runs will increase. And then she wants to become more cardiorespiratory capable. Okay, that's going to be training more for her cardiorespiratory capacity, not for strength, muscular strength necessarily. So that's why it'd be movement, not the load training. So that takes care of that. And that's going to be the first one. Okay. So she's in the movement training. What assessments did she? Probably did a movement assessment. We don't know any other assessments, but that helps you to understand the phase determination part of it. Now, here's the one that can kind of confuse you a little bit, and it's important to read through this one. This is a guy who works in a warehouse, and his name is Philip. He doesn't consistently perform regular cardiorespiratory, so he's in the base training, simple, easy. However, he during the first scheduled session, Philip demonstrated that he can perform exercises. Now, if you read a little bit on page 532, the page before that, you'll realize the guy lifts heavy loads. He's got shoulder problems. And the first thing you're saying to yourself, well, I guess I got to do a lot of assessments. No, that's not your job. Your job is not to do what the therapist did or what the doctor did. You're not doing an assessment to see if he has. No, your job from an assessment standpoint is determine where should he be. Does he be in the movement phase, or does he need to go into the load speed training? Now, from what I just told you, the guy has shoulder problems. He's been to the doctor, right? But during his first session, he's demonstrated he can perform exercises across the 5 primary movement patterns with no loss of postural stability, no compromising of postural or joint stability. Why are they going to start him in the load speed training? It's because of his goals. You get it? So when we look at the other question of a golfer, if he has a specific goal, generally the idea for somebody that's lifting heavy objects over his head, things like that, requires that we look past just basic movement patterns that don't require resistance training into load or speed training. Load meaning that now we have to use resistance in some way, shape, or form to assist with the outcome goal. For a golfer, that is going to mean probably some sort of resistance training to help him move the club faster, right? Hitting harder, things of that nature. So this should be a little helpful. That's why he is in the load speed training. Why? Because he showed obvious control. Now remember, this is a muscle or a movement assessment that he did. Again, what ACE should have done is they should have told us what other assessments, and they don't tell us. Unfortunately, they don't tell us that. It would be nice to know that his trainer performed a static postural assessment or did not perform a static. But again, from answering the question perspective, don't be overly concerned about that, because once you get the phase, now you can answer the question. What are the 2? Well, they already gave you one. Remember, the Y balance test is generally for athletes. So that's one of them that you already got. Okay. All you have to decide is whether they needed to do flexibility, static, postural. And once you cancel out those other 2, the second answer is going to pop out in front of you. The idea then for this third one is now you have somebody that's a completely inactive base training. This is Claire, right? She's an older lady, and she's she did her initial session, and she couldn't do the 5 primary movement patterns, and therefore she's in the functional. What kind of assessments do you need to do? I don't know. Claire probably came in, walked in, and maybe the trainer saw that she was in, she could walk, no issues, but let me do at least one assessment just to make sure. See, that's what we don't know. So again, 2 parts of this. Answer the question based on the information that you got. Don't try to do assessments just because he's a golfer. No, do the assessments as necessary. You don't do lots of it. You try to do as few assessments as is necessary to determine what phase they're going to go into. And so, again, I would go through these samples that they have on page, like I said, page 5, starting on 521. There's 3 of them. They make sense. It's easy enough. The question, of course, is what assessments did. Generally, it's going to be movement assessments. The Y balance test is really the only of those 4 that was an easy one to pick out because he's an athlete. You have to determine now whether you want to do static postural, which probably you don't need to do with this individual. But I didn't answer the question, and I don't remember all the answers to all of these quiz questions. But more than likely, you're going to look and make that determination now based on what you read in chapter 10. Look, I hope I can keep going on and on, but I hope this is helpful. If you have any other questions, message me, or go ahead and put them back into the group so that other people can see the responses that you made. Again, I hope this is helpful. And remember, go ahead and keep posting these questions so that at some point we can delve in a little bit deeper into them. But always keep in mind, we want you to pass your test right on the first attempt. So I got to get you to understand, I want you to understand those questions and how to respond to those questions first and foremost. Amy, I hope this helped out. I'm talking to you directly because you're the one that posted it. Y'all have a great weekend, and we will see you next week. Thanks. Bye.